Bismillahirrahmanirrahim. So let's discuss the strokes related to the posterior circulation. So what's gonna happen when the we cut off the supply of the midbrain? So we're gonna discuss the midbrain, then I'm gonna discuss the pons, then I'm gonna discuss the medulla. So let's discuss midbrain first here. Okay, basically I'm gonna discuss the brain stem here. So this is a midbrain. This is a cross section at the level of the third cranial nerve, and we'll have the superior colliculus at the level of Edinger-Westphal nucleus, third cranial nerve, right? So Edinger-Westphal nucleus will have the motor nucleus along with that. So basically, Edinger-Westphal nucleus is a parasympathetic. So this is a third cranial nerve nucleus along with that, right? So we'll have this one, third cranial nerve. So in the center we'll have this central canal, right? Okay, and this structure, small red structure, is called as the red nucleus. That's gonna connect the midbrain to the basal ganglia. And another structure, this structure is called as the substantia nigra, right? So this structure is called as substantia nigra. So anterior part is much compacted, so this is called as substantia nigra pars compacta, and posterior part is called as substantia nigra pars reticularis, right? So basically when this is damaged, so we'll have the disease that is called as Parkinson's disease. So this is a part of Parkinson this is a part of basal ganglia. So when it gets damaged, so we'll have these features like that of Parkinson disease. So anterior to that we'll have anterior most structure. This structure is called as the crus cerebri, right? Crus cerebri. So in this crus cerebri we'll have the corticospinal fibers that are going to descend from the cortex. Then they're going to descend from the they're going to form the coronal radiator, and they will then descend to the internal capsule, and on the way they're going to also connect to the thalamus, and then they're going to descend from the midbrain, pons and medulla. They're going to decussate at the level of the lower medulla, right? And they will decussate to the opposite side, right? So we will have these corticospinal pathways, right? Okay, so here in the green, so we'll have this one is called a superior cerebellar peduncle, right? So this is superior cerebellar peduncle, right? Okay, so let's discuss the syndromes related to this one. So let me discuss the blood supply of the midbrain. So this is the branch, right? So this branch is the till here. This branch is called as the posterior cerebral artery, right? So this is posterior cerebral artery, right? So this is the P1 port segment of the posterior cerebral artery, and the P2 segment is going to supply the occipital lobe. So that one is called as the P2 segment of posterior cerebral artery, right? So what happens if I have drawn a structure here, I have drawn an infarct here. So this infarct here, if this branch is of P1 PCA is involved, so what's going to happen, we'll have the third cranial nerve palsy, and then we'll have the contralateral hemiplegia, right? So this syndrome is called as the Weber syndrome, right? So this syndrome is called as the Weber syndrome. What happens in this, that if there is ipsilateral third nerve palsy, we have this cranial nerve that is passing through the through this area. So what's going to happen, there will be ptosis, there will be squint, right? So there will be ptosis and squint, and there will be contralateral hemiplegia. So Weber syndrome is basically there will be ipsilateral third nerve palsy and contralateral hemiplegia, right? So this is called as the Weber syndrome. So another syndrome I have highlighted in this purple color, right? So when there is infarction of this artery, right? So what's going to happen, there will be red nucleus will be involved, and we'll have the third nerve is involved, and red nucleus is involved. So this syndrome is called as Benedict syndrome. So this is basically C, Benedict syndrome, right? So T is there, right? Okay. So what's going to happen when the third nerve, there will be ipsilateral third nerve palsy, and because of the involvement of red nucleus, so there will be contralateral chorea, choreiform movements, and the resting, there will be resting tremors, right? Plus sometimes what happens, this substantia nigra is also involved, so patient might have the vascular Parkinsonism like features, right? Okay. So we know that when basal ganglia is involved, there will be chorea like, and there will be athetosis, and there will be tremors, resting tremors in those patients, right? So this is called as the Benedict syndrome. So first one was the Weber syndrome, and the second one is the Benedict syndrome, right? And the third one is the, we can see that Edinger-Westphal nucleus is involved, right? Third nerve nucleus is involved, right? And there is involvement of superior cerebellar peduncles, right? So what happens in this case, there is ipsilateral third nerve palsy. So in these patients, as third nerve is involved and superior cerebellar peduncle is involved, so what's gonna happen, and there will be ipsilateral third nerve palsy, right? And there will be contralateral gait ataxia, right? And intentional tremors. As we know that the superior cerebellar peduncle is going to connect the this to the cerebellum, right? So this is going to connect that to the cerebellum, right? And when this pathway is hampered, so what's going to happen, there will be ataxia and there will be intentional tremors, right? So I have discussed that when basal ganglia is involved, so there will be resting tremors, right? So when cerebellum is involved, so we'll have the resting tremors in these patients. So this syndrome is called as North-Nagel syndrome, right? So this syndrome is called as North-Nagel syndrome. Okay, so I have discussed the three syndromes that are related to the infarct. So let's discuss another syndrome that is related to the pineal gland. So we'll have this pineal gland here, right? That is present in the midbrain, on the posterior aspect of the midbrain. So when there's a tumor of that, there is pinealoma. So what's going to happen, this actually control the circadian rhythm. So when there's pinealoma, this is going to erode the superior colliculus, and superior colliculus is responsible for vertical gaze, right? So vertical gaze, right? And for horizontal gaze, right, so we'll have I have discussed there is in Brodmann area 8 in the frontal lobe, right? So that is responsible for the horizontal gaze, right? So when there is pinealoma, that is going to compress the superior colliculus. Basically we have 4 colliculi here on the dorsum aspect of the midbrain. So upper two are called as superior colliculus, and we'll have the inferior colliculus at the level of the 4th cranial nerve. So when superior colliculus is involved, so when there is pinealoma, so what's going to happen, so there will be a syndrome that is called as Perrinard syndrome, right? That is seen with the pinealoma. So we'll have the features of raised ICP, right? And there will be impaired vertical gaze. So mainly there will be upper gaze is affected in this case. So upper gaze is affected, so patient is going to have the sun setting sign, like that of we see these features like in the newborns of patients with hydrocephalus, right? So those patients also going to have the sun setting sign. So the eyes will be like this, right? So I'll be like this, okay? This is called as sun setting sign. All right, so there is another syndrome that is called as progressive supranuclear palsy. So in these patients, mainly downward gaze involved. So let's discuss that too. So we'll have this one, progressive supranuclear gaze palsy. What's going to happen in this case, there will be mainly downward gaze that is involved. So there will be history of recurrent fall. So eyes will be like that. Okay, so let me draw the eyes, right? Okay, this one is second eye. So eye will be like that, okay, like that, okay. I will be like that. So These are called as the sun setting eyes, right? That is seen with the Perinaud syndrome. And in progressive supranuclear gaze palsy, the downward gaze will be affected and eye will move upward, right? So here I will move downward. So I have discussed the two more things related to the midbrains, right? So I think that's enough for today. So let's discuss the syndromes related to the bones in the next section. Okay, that's all for today.